Hi, I'm Michael Burke, and welcome back to Pathways of Hope. With me is,
Chan Hellman from the University of Oklahoma and director of the Hope Research Center.
and Jen is a leading hope theorist in the country and leading hope researcher that really has taken the time to define and understand hope. We're really going to dive into that in the next segment about hope theory and the science of hope and the four processes going down and the four processes going up and how to nurture hope. But we know a lot of frontline people are out there right now, a lot of doctors, a lot of people with counties and states and national governments that are helping develop a plan to combat this COVID-19 process. We're learning from the past that others have done in, say, China or Italy. We're trying to learn from New York in our country, and we're trying to create processes all over the country to help people stay safe. Is it easy to lose hope in this situation?
It can certainly feel overwhelming. We're constantly barraged. You turn on the TV or the radio, and you're going to hear fear and despair, and it's pretty easy to get caught up in that. And when we operate from a base of fear, despair is not too far away.
How can we support the people that are on the front lines?
Sure. So I think recognizing that first of all that we're in a moment in time. We are going to get through this, and so I think recognizing first of all, and as you were going through the list of the essential workforce in our communities, another group that I was thinking about this earlier. I went to my grocery store and they have a pickup framework where I can drive up and they'll bring my groceries to me. But I was watching the young man and young woman push the carts from the parking lot back into the store, and I think, these are hope heroes, Mike. These are the young men and women who are day in and day out risking their lives as well. And I think, the thing that we can do is first of all appreciate them. And we have such a good recent history of acknowledging and thanking the service members. I think we need to do that with these essential workers as well. Is know that they're appreciated, know that we recognize that they're risking their health for us.
They really are keeping things moving, aren't they?
They really are. They really
Yeah.
are.
And you can imagine, hope is, as we've talked in the other calls, the ability to see my future can be brighter than my past, and I take a role in making that happen. Now, I think as a country, what our leaders are doing, what our essential workers, what our first responders are doing, is they're saying, this will get better at some point, and I'm going to be part of making that better. Um, what can what words of advice do you have to those essential workers or first responders?
Well, first of all, thank you. And thank you from the bottom of my heart and from my family. But, hope is a social gift, Mike. Hope is not something that happens for each of us in isolation. Hope happens in relationships. And, so, you know, being connected to others, serving others, working towards the benefit of the greater good, um, is it's such a significant predictor of well-being in itself. I mean, the science is quite clear. Serving others can lead to happiness, but it can also lead to exhaustion. And so we have to find strategies to give them space for their own self-care and their own well-being. Good friend of mine for the local United Way told me he was feeling guilty because he took a little bit of time off yesterday. And, I just wanted to remind him, first of all, thank him for, the work that he's doing. But also, if you're going to be part of the solution, you have to be present. And in order to be present, you've got to take care of yourself.
So how can we take care of ourselves? So prior calls, we've talked about setting a goal for the minute, the hour, If you lose hope, how do you refind it? So how do we take care of ourselves in this situation?
Yeah, so I think we can break it down very simply, as you said. If we're gonna set a goal for self care or set a goal for well being, so what is it that you're going to do every day? Are you gonna walk around the block or walk for 15 minutes? Set goals, find those pathways, and start the journey towards your own goal achievement.
And Brene Brown says you cannot give children what you do not have. If we take that quote a little bit bigger and say we cannot give what we do not have, I think it's important for all of us that are at home, that are sheltering in place, that have first responders and essential workers out in the field to help them have hope. Because I, I've seen it happen in organizations that were low hope organizations that then they put out low hope products. And I think during this time, do you have any advice or thoughts, or just what are your thoughts about creating hope in a workspace or in a collective impact model?
Sure, sure. So, first of all, leaders, thinking about hope informed leadership, trying to make sure that you understand what are the goals and pathways that are available for your workers. We've been studying this idea of collective hope for the past couple of years, and this would be a great opportunity for organizations or communities to start thinking about, especially in the framework of our essential workers and healthcare providers. What is our collective goal, and how can we be pathways to helping them achieve wellness for our communities via support. We've talked about sewing masks, or, you know, I've been seeing a few things on Facebook where, people like teachers driving around to the kids' house, or kids' families driving to show appreciation for teachers. And I even saw one, Mike, where people did this in a hospital setting, and I think that's our role. We can show that appreciation and support um, for the hard work and the fact that people are putting their well being on the lines for each of us every day.
And I know if you have a 2 point increase in hope in the work environment, your productivity goes up by 1 hour. So what a person can do in 7 hours, if they have low or moderate hope, a high hope person can do, I'm sorry, a low hope person, it takes 8 hours to do what a high hope person it takes to do in 7 hours, right?
That's right. That's right. We see better productivity for sure. We see actually lower burnout as well when we can increase hope scores, and we see lower turnover as well. So, you know, increasing hope in the workplace can have significant gains for leadership of those organizations.
And I think it's important to realize too that the leaders are probably tired and nervous, and they have the training, they have the background, they're doing what they need to do. But I'm sure that they get on your scale rage because things don't go right, or they get down to despair because their goals can't be achieved. Um, so for the leaders in our communities and the people doing this, I just applaud you for what you're doing. And I think that it really matters that you're doing what you're doing right now. So we appreciate that. Are there any final thoughts or any um, things that you want to add to this conversation about supporting essential workers and first responders?
Well, I think for those essential workers and first responders, when you find yourself emotionally exhausted, you're just kind of at the end. You know, don't be afraid to think um, at a smaller, short-term framework. What can you focus on this hour? What can you focus on this minute?
Mm.
And try not to get too wrapped up in the 30,000 foot framework all the time. Some of our responders have to, but don't forget to break things down into their smaller increments.
Well, I look forward when I can see you again and give you a real hug, bro hug, face to face. I know that will be at some point here in the future, and that's my future memory of success. That's me thinking what it's like to be around you. But Chan, you're instilling hope in me right now, just over these conversations, and I really appreciate your time. We'll come back next time with a different podcast about hope, and this has been Pathways of Hope with Michael Burke and
Chan Hellman.
so thank you all very much. With great hope, we hope you go forward and do great things in your community. And thank you.